to give a report on a 45-year-old female who came in for a head-to-toe assessment. She was alert, oriented ×3, good nutritional status. She was healthy for her height and weight. Her BMI was appropriate. She had a steady gait, no prosthesis, no deformities, no crutches, no canes or anything like that. She didn't use any of that. She spoke clearly and coherently. English was her main name. She said she was in a great mood. She was smiling and happy, and she did well. She had a good posture. She was very clean. We looked at her skin, pink and dry. Hair distribution was good, upper and lower extremities. Her hair was brown, clean, no dandruff, no lesions, no break in skin noted. Her peripheral pulses, brachial and radial, were palpated. Everything was strong. Her capillary refill was less than 2 seconds. She had good range of motion in her upper and lower extremities, very strong. No complaints of pain throughout anything. We went, assessed her head. Everything was symmetrical, no bumps or lesions or bruises noted. We assessed all of her accessories in her eyes. We assessed all cranial nerves. Everything was intact. Her temporal artery was palpated, no thrills noted. Maxillary and frontal sinuses, she denied complaints of pain. I checked all of her lymph nodes in her neck. She, again, denies any tenderness to the trachea, to the neck. We palpated her thyroid gland, no swelling, no enlargement noted. I checked her carotid artery, no lumps, no thrills. Everything was checked one at a time, and everything was auscultated bilaterally, and no murmurs or thrills noted. She, her range of motion was good. We checked her olfactory nerves. Her everything was good. Her external structures on her eyes were good. Her sclera, her irises, her cornea, everything was pink and moist, and the conjunctiva was pink, white, brown. Her irises were brown. Pupils were equal reactive to light and accommodation. She had no complaints upon palpation to her ears. She denied any complaints at all. Her nose was midline to her face. No drainage noted from there. No breaks in skin noted. The septum was even to her face. I assessed her lips. No break in skin noted. No break in her lips noted. Her oral mucosa was pink. Her tongue had no white patches. Her hard and soft palate was moist and pink. Her tonsils were intact. They were moist and pink. We did the TMJ test. It was negative. So then we moved to her posterior. AP to T diameter was midline for her posterior lungs. Her respirations were even and non-labored. They ranged around about 18. She did not use any accessory muscles. We auscultated posterior and anterior lungs, all lung fields. I checked her CVA tenderness. She was negative for that. I listened to all bowel sounds. We did light palpation and deep palpation. She denied any complaints of pain or tenderness. No limps, masses felt. Heart sounds, apical pulse was auscultated, lying and sitting. Her heart rate was strong with a steady rhythm. No murmurs noted. We auscultated her apical pulse right at the mitral valve midline. Her back was nice and flat, no scars noted. Her chest, her abdomen was good, everything looked good. No scars noted, no lumps, no peristalsis noted. Her umbilicus was midline. when we assessed her abdomen area. Bowel sounds were present times all 4 lobes, tympani to percussion in all lobes. We did the palpation. Her lower extremity, her hair was generalized in the correct areas. Her skin was pink and warm. No lumps, bruises, no edema, no varicose veins noted. We checked all pulses, peripheral pulses, femoral, popliteal, posterior tibia, dorsalis pedis. She had good strength, good range of motion. We did a heel to shin. It was negative, but patellar was positive. We did a scoliosis screen. Her spine was midline. Her shoulders were aligned correctly. Her hips were also aligned correctly. While she was lying and when she was standing up, we assessed all of that for her part of her scoliosis screen. And she denied complaints of pain or tenderness throughout the whole exam. She was able to move around in different positions freely and moved all her extremities well while she was changing positions. And again, she had no questions during the assessment, and she did really, really good. So that will complete her head-to-toe assessment.